The nursing theorist that I chose is Ida Jean Orlando. Ida Jean is most famous for her deliberative nursing theory. The purpose of this theory is to explain the nurse's role in discovering and meeting the patient's immediate needs and any needs along their hospital stay or their time in a doctor's office or wherever you may encounter them. The theory's key concept is the organizing principle. This organizing principle is the idea that all patients' needs should be determined and then appropriately addressed. The patient should be the primary focus of all care no matter what you do. Nurses should directly provide appropriate help to meet the patient's needs. I selected this theory because I had previously reviewed Ida Jean Orlando in another class, and I wanted to dive deeper into her theory and some of her ideas, especially the deliberative nursing theory. I also chose this theory because as a nurse, every action that we take should be deliberate and intentional. Nursing is a career that can kill a person when not done intentionally and correct. I also chose this theory because when I became a nurse, my dad used to tell me that no matter how bad my days were, that I should still treat patients appropriately. I should go out of my way for the patients because when we go into their room every single day, this is their worst day of their entire life. Some people may not have even had an experience in the hospital before, and so they come with a lot of emotions, a lot of fear, a lot of trauma. Some of them actual traumas or just trauma from having to be in a hospital for the first time, or with COVID, having to be away from their loved ones. We've become the loved ones, especially for me with my patients in the hospice setting. We're the last ones to hold their hands and the last ones to be here for them. If I can take a little bit of their stress away, I would love to do that from any patients. Me being intentional with my actions and trying to meet their needs is the best way that I can meet Ida Jean Orlando's deliberative theory. Recently, I had a comfort care patient that was unresponsive and had been very healthy until this patient was a part of what we call a freak accident. This patient was fine at home, completely ambulatory, alert and oriented, didn't even walk with a walker. He fell and hit his head, had a traumatic brain injury that caused him to be unresponsive. I watched the wife sit by his bedside for 4 days and never let go of the husband's hand. I realized in that moment that I was not just taking care of the husband, but also the wife and her mental health. She was a diabetic and was not eating. I would go out of my way to make sure the patient's wife was taking her medications and was at least eating a little something every day so that her blood sugar would stay up. This nursing practice was deliberate and based on the organizing principle that uses patients' facial expressions, tone of voice, body stance, attitude, etc. to determine the severity of the situation and to determine what our correct responses should be to these situations. Orlando's nursing theory views nursing as a holistic practice that should be based on not just the patient, the way they look or the way that they act, but everything as a whole. How they interact with their doctors, their nurses, their family, all of that. We should also take into consideration their beliefs and their feelings. And if they have an attitude out throughout the day, we should try to change those. And of course, we need to meet absolutely all needs that we can meet while they are in the hospital with us. This theory can be associated with many different clinical nursing jobs. These jobs include clinical nurse leaders, or nursing educators. In my opinion, everyone uses Orlando's deliberative theory because we should all be deliberate in the actions that we choose. It is associated with clinical nurse leaders because a CNL is a leader in all settings that do not complete administration or management. The clinical nurse leaders are accountable for patient outcomes, and the better outcomes are whenever you are deliberate with your actions and you try to meet all patients' needs. It is proven that we have better outcomes with all patients and their hospital stay, better ratings. Nursing leaders that practice on the executive level have a vision for nursing practice. They believe nursing practice should be safe, timely, efficient, and patient-centered. Nurse educators' jobs are to educate nurses and future nurses on patient-centered care. All three of these nursing professions use Ida Jean's deliberative theory because they all focus on patient-centered care and good outcomes.